There are a lot of medical studies in the news every single day. Wouldn't you love to call your doctor to see what they think? Well, that's what I did. Dr. Melinda Silva joins me here in studio today to help me break down some of these new findings. Dr. Silva, welcome back to Smart Life. There are a lot of new medical studies that have completely really revolutionized the way we think of health over the last decade. A lot of these are related to hormones. Right. Hormone therapy has become huge in the medical industry, and it has actually replaced a lot of more traditional Western models of the past. Testosterone is a new thing that people are studying, all sorts of effects that testosterone has on the body, but you know about a new study that you say is really landmark.
Right. There was a research study out of University of Texas, out of the Galveston branch, that was recently published in Annals of Pharmacotherapy on July 2nd. And what it showed was that they studied over 25,000 men that had Medicare and over an 8-year period. And that study showed that testosterone did not increase a man's risk for heart disease. Actually, that study showed that men who had higher risk for heart attack, that those men had lower risk after taking testosterone treatment. So it was a great study to show. I mean, there's a lot of studies that also verify that, but it was a conflicting study out of JAMA recently that put people in an uproar about whether or not they should take testosterone. And you might see the commercials on television that said, if you had a heart attack and you were taking testosterone treatment, please call your lawyer to see if you could get compensation.
Right.
And that study was actually a flawed study. And there was a retraction that was made online, but not in print. So it's no reason, I mean, you could see why people get confused. The public gets confused because there's these conflicting studies.
Yeah, and the hormone replacement has become a really popular issue. A lot of people are finding that they can cure all sorts of ills by just simply, sort of equalizing their hormones, getting a panel, figuring out what you're high in, what you're low in, and supplementing those things. Some warn of all sorts of things. I've heard cancer. I've heard all sorts of things because I've actually done some of those replacements myself. What do you advise people?
Well, I think you should be followed up with somebody that knows how to look at your clinical symptoms and then evaluate your hormones. You wouldn't ever take insulin, right, without checking your sugar level, or you wouldn't take thyroid hormone without checking your thyroid levels. Well, you shouldn't take any of the other sexual hormones, progesterone, testosterone, estrogen. It's the same thing. You'd want to check those levels. It's just that mainstream medicine doesn't routinely check those levels. And because that's what they just know. That's just the way that mainstream medicine is practiced. They don't check the sexual hormones, and they will give women and men certain doses without checking the levels. But in men, they have been checking testosterone levels because of the fear of prostate cancer. But there are no studies that show definitively that testosterone causes prostate cancer. That's actually a myth. And that's very scary for people because they don't understand and they trust their doctors. But the reason why the patients are confused is because sometimes the doctors are confused. Because if you don't take the time to really look at the studies and really investigate which studies are good or not, then you will just see the headlines.
Right.
And the headlines show, testosterone causes prostate cancer, and it's not even
And a lot of times the headlines are funded by those who are making money off of the argument being swayed one way or another. That's why it's important to have such a good doctor who's personally interested in the research and what's good for their patients. One that I've seen interesting that I thought was just fascinating was this idea that if you use sunscreen, even if you don't go into the sun, something about using sunscreen every day has an impact on aging.
Right.
Talk about that.
Because the sun causes premature aging on your skin, because the UV radiation can actually break down collagen and elastin. The collagen in our skin helps our skin to repair itself. So if you get a cut, it actually will help repair your skin. But the UV rays will kind of disrupt those collagen fibers so you don't heal as well. And so you might bruise easier, you might get vessels, those red veins and vessels that you see. That's from premature aging from sun exposure. Also, elastin fibers can be affected with with prolonged sun exposure. And what that means is that then your skin will sag and you're more likely to get, see the wrinkles if your skin doesn't have that firmness or that elasticity. So that's the sunscreen can actually block the breakdown of the collagen and elastin if it's used correctly and reapplied.
So put it on every day, even if you're not planning to be in the sun, and even if it's not summertime. I know I
Right,
put it on every single day.
Yeah, on a cloudy day, you can also get the
even through your car windows, the whole thing. All right, low vitamin D linked to premature death. Tell us about that.
Well, there was a great study that came out of UCSD, which they looked at over 32 countries and over 500,000 people. And in this study, it showed that when the patients had a vitamin D level close to about 30, which is considered suboptimal, they had twice the chance of dying a premature death, which I think is a remarkable study because it's very easy to take vitamin D. It's very inexpensive. I love vitamin D. Vitamin D is actually a hormone. It's not a vitamin. It's actually misnamed.
Wow.
And most people know vitamin D as helping calcium absorption. So what that means is that if you have osteoporosis and your vitamin D levels are low, no matter how much medicine, prescription drugs that you take to help osteoporosis, it won't help you if your vitamin D level is not adequate. So the vitamin D not only helps with decreasing mortality, but because it helps with your bones, it helps with osteoporosis, it helps prevent hip fractures, which is still a leading cause of morbidity and mortality in women. And it also helps strengthen your immune system. So there's a lot of vitamin D studies that show that can help prevent or reduce your risk of cancers, including breast cancer and lung cancer and colon cancer. So I check everybody's vitamin D level. In my specialty of hormonal care, that's one thing that I check for everybody is vitamin D because it's an easy supplement for people to take. I've never had anybody have a side effect from it.
Yeah, so
and
why
it's
not?
It's relatively inexpensive, and it's something that people should just take. It's actually my favorite vitamin to take, even though it's a hormone.
Yeah. Well, one of the things that I think is interesting, the diet industry, they make a ton of money by telling you that this diet works, that diet works. It strikes me that lots of doctors that I've met in my lifetime will prescribe diets that I know don't work long term. My diet of choice has always been HCG. I love it because it's tailorable. You lose the weight initially, but then the maintenance is very workable for the rest of your life, and it's just not something that is a real alteration of your lifestyle long term, and I love that about it. You do use HCG, and in fact, in one particular instance, I'm just going to lay this out. You saved a guy's life pretty much. This guy had health problems that were very, very serious. He was, I believe you said, in his 60s.
He was 65,
and
over
you
100
turned
pounds.
his whole life around. Tell us about that.
Well, this gentleman, he was over 65 and he was diagnosed with prediabetes. His blood pressure was increasing and he had cholesterol issues. And he knew it was time for him to make a change. He was at a fork of the road, saying, I'm going to empower myself to eat healthy and do the right thing, or I'm going to end up taking diabetes medications and other medications for the rest of my life. He chose not to take the prescription drugs. And when I saw him, he was very motivated, but loved the HCG diet because the HCG diet just focuses on whole food. I mean, you're eating fresh fruit, meat, chicken, fish, vegetables, food you're supposed to be eating anyway. And so we were able to incorporate it. I don't do the traditional HCG diet. I don't do the 500-calorie diet. I only use the injections because they work much better than the oral solutions that they have. And we were able just to change his lifestyle. And the HCG was just the boost that he needed to give him that motivation to keep going along the right road that he knew he needed to take. But it's hard because people that do fad diets, they get frustrated because they try and then they get stuck. They don't lose weight and then they give up.
Yeah.
Because there's metabolism issues, hormonal issues, and other issues that keep people from losing weight. So that's why it's always better to follow up with a doctor, somebody that you can trust, that can help you sort out those issues. And it might be about eating the right foods that increase your metabolism. I mean, they have nutritionists for that. It's amazing what you can do to help your body lose the weight naturally. And since HCG is a natural hormone, I love using it because it's not something that people will have a usual reaction to or problem to, because everybody saw HCG as a baby. It was the hormone that helps the baby grow and develop.
Right.
Sometimes people get confused because when I say HCG, they're thinking HGH.
Right, the
It's
human
very-
growth hormone.
very
Different thing. Dr. Silva, lots of great information here. We've got your information up there. If somebody wants to contact you, thanks for being on the show.